The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello, everyone. So I'm back with two of your favorite dentists. I've had both of them on as individuals and as a duo, but we have Steven and Hamza here again, and they are both working as associates, but in different settings. So we're going to kind of chat about finding associate roles, the differences between maybe working in different types of offices, and any advice that they have for dental students getting ready to enter into working as an actual dentist. So, Steven, do you want to go first? Just kind of catch everyone up on who you are and what you've been up to.
Sure. Yeah, my intro should be shorter than Hamza's. So I started at a federally qualified health center and I'm still there today. So I started in August 2020. So it's been about probably a year and a half. I am mainly in one location, but my place has multiple locations. It runs as a private nonprofit. So some of my coworkers think it's more of like a corporate, but it still qualifies as a federally qualified health center. There's other professions with us. There's social workers, pharmacists, physicians. So there's plenty of providers to help the patients, and the funding comes from the state and the federal. So yeah, that's how they provide for our nonprofit.
Awesome. And Hamza, do you want to give some background on where you started off and where you're working now?
So my name is Hamza. I currently practice in Austin, Texas. I currently work in a private practice with a group of other doctors who own the offices. They currently own about 6 offices now in Austin, and I work at their first location. I moved to Austin in February. I was actually working at a community clinic last year in Houston, and basically just transitioned to Austin with kind of the goal of, starting to transition more into cosmetic dentistry and a little bit more like modern dentistry. And just wanted to kind of dip my toes in that aspect of it, do more Invisalign and veneers and stuff like that. And hoping to, in the next year or 2 years, own a practice with another doctor that I work with. Her name is Dr. Karavi Patel. And that's pretty much the background of it.
Nice. So it's called Enamel, right? Is that the name of the
Enamel
practice?
Dentistry.
Okay.
Yeah, and it's owned by 2 doctors who actually went to the same undergrad as me. And
nice.
They heard about me through a mutual friend, and we connected while I was in Houston during COVID. And they basically offered me a position, and I kind of jumped at it as soon as I could. It's been a great experience. It's a huge difference from where I worked last year, but I feel like it's been a good kind of journey through my whole dental experience so far.
So as for talking to dental students, what would you guys say is some of your advice for finding an associate role that would be a good fit, like going through the job search?
I'll let Hamza answer this one because I think he has more experience with it, and it's a different perspective coming from someone that is looking to work in private practice, because every office runs differently based on like the owner, right? So I'll let Hamza answer this one.
I'm sorry, Haley, cut out earlier. What was the question?
Advice for dental students finding the right fit for an associate role.
I think it's kind of like dating. You don't really know your type until you kind of like date around, if that makes sense. So I didn't really know what I was looking for when I first graduated. I just went on a bunch of interviews, and eventually I made like a kind of Excel spreadsheet full of questions that I found important to me, kind of like, what's the culture like here? What's the amount of hours a week you work? what kind of instruments do you guys use? Do you do a lot of endo, stuff like that? So I think it's different for every student. So I mean, whatever I say might apply to a couple of students. Whatever Steven says might apply to a couple of students. It's just a matter of personal preference. But I think the biggest thing for me that should apply to all dental students coming out is like the ethics of where you work. I think that's super important because I kind of learned the hard way. The first job I worked at, it was a corporate practice. And I'm not saying all are like this, but I felt like the ethics of the dentistry were very questionable. And I was there for about 6 months before I decided to leave because I didn't really agree with like the culture and the dynamic of the treatment plans. And I'm glad I worked there because I learned a lot of things about what I don't like and what I don't want to do. And so that's another thing I'd say is like, even if you do end up at a practice that wasn't the right fit, don't ever look at it as like, oh, I made a big mistake and I regret this. And all, like, just look at it as a great learning experience because you basically learned what you don't want in the future. And it'll help you even when you want to make your own private practice, you might know exactly what to avoid with doing your own kind of private practice.
Yeah. And I would love to know, I guess, from both of you, if you could kind of describe what realistic expectations should be for a new grad. Because I think a lot of us, of course, it'd be great if you get an associate role. There's such a great mentor. You buy into that exact practice and like, it's just a dream job. But for most people, they bounce around from a few places to try to find the right fit. Or like Steven, you're at the FQHC, you're getting a loan repayment scholarship too, which is helping. Like, do you plan to stay with an FQHC long-term? Or are you still figuring that out? Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started.
That's a really good question. So I don't know, last time you probably messaged me or reacted to my story when I got the $300K loan repayment. I actually don't have that at all anymore.
Oh, okay.
So a little background, the $300K loan repayment is the best one in the country. It's California funded, and it's paid for by the tobacco tax. And it's for physicians and dentists who work in a area in need, and you have to treat at least 80% Medi-Cal patients. So you see a lot of underserved patients. The reason why I couldn't accept it, me and my coworker actually had the same issue, is because we applied for the 50K state one. Most states have a 50K loan repayment. And then when I was trying to drop that first one, because you can't have two at the same time, it was past the deadline. When I was past the deadline, I would have to be fined $110K plus interest. So that's crazy. So I don't have any anymore. So right now, I'm just thinking about doing the 10-year loan forgiveness while being on the repay plan, paying 10% of my income, and then working here and getting loan repayment each year. So each year I wouldn't have to pay any of my own money. That's the plan for now. We might get into this a little later. But I feel like, I don't know if I do see myself here the entire time, because like Hamza, once he got, he's doing cosmetics now, and I was planning more cosmetic stuff in my federally qualified health center. And I realized that is the stuff that like excites me and makes me want to learn more and be happy to go to work. So that's a little bit about the the loan repayment and where I see myself right now.
Yeah, I kind of put you on a tangent than what I originally started with there. But I guess while we're on the subject of like, I guess, finance and like that kind of planning, do you have anything to add to that, Hamza?
Yeah, financial planning, I think, is something that I took super importantly from the day I got out. So, first thing I did when I got out was I started to read up on financial information. I think, unfortunately, we're not educated that much in dental school. And so, you kind of have to take it on yourself to take that responsibility. And it's kind of like ignorance is bliss for those 4 years in dental school, which is kind of unfortunate because you're stressing about other stuff, understandably. But if you're a dental student right now listening to this, I would definitely advise you to be very smart about how much you're taking out for loans, because you might think of it as like monopoly money, like, okay, I'll worry about this later. But just think about the interest rate and how much that's going to affect you in the future. And then the other thing to consider is once you do get out, try not to hold it up or push it back as far as you can. Just try to start as soon as you can. And what I did was I kind of established the reasoning that, okay, I'd rather invest in a financial advisor and an accountant right now. And I know it's going to cost money to have both of those, but I'd rather spend the money on those people and know how to handle my finances well, rather than learn it myself and waste time. Because at the end of the day, time is also money. So the more time you dedicate to doing stuff like that, you could be doing other stuff like, learning how to establish a practice, learning about or going to CE courses and stuff like that. So that's how I kind of looked at it. But if you're financially savvy or you're into business and you love learning that stuff, like, more power to you, because I am still learning it, but I'm learning it through my accountant, through my financial advisor who work with dentists and doctors. And it's nice because they've had the history of working with existing doctors. So I'm kind of learning through them, and they've learned through past experiences with other doctors. So it's kind of like you get the best of both worlds. And I tell them too, like, this is something I want the dental students to know. It's like, even though you do have these guys like the financial advisors and the accountant there, you should still ask them to explain things out to you, because it's good for you to also know why they're doing what they're doing, like why you're investing in backdoor Roth, or why you're basically establishing like as an independent contractor, and why you're going to make your own company. Like, all these things are really useful pieces of information, because it benefits you not only in the long run, but you can impart this information onto other dentists or students in the future.
Would you guys say it would be a good call to just like get a financial advisor right when you start working, to try to figure out the best game plan for paying off any debts and managing your income? Or do you think would you say it was fine waiting a few years? I don't know if you did, but would you say like get into that right away or wait a little bit?
For me, like Hamza, I basically, when I got the job offer, I started reading a lot of books on being financially savvy. I don't have a financial advisor like Hamza. Maybe it's just my personality, but I think it's how you view it, because it is an investment. Like school, it's an investment. But I think for me, I like to learn everything myself. Because if I go through the motions, actually Hamza actually got me into investing in more cryptocurrency and stuff like that. So just being in it taught me a little bit, but obviously there are professionals too. So I haven't considered that as of right now, but yeah, there's a lot of books out there that are really, really good for understanding. And one of my favorite books is I Will Teach You How to Be Rich by Ramit Sethi. I think that's how I'm pronouncing his name correctly. But for basically from 0 to like 100, he explains everything in the most simple terms.
Nice. Yeah, I feel like that's exactly what Hamza said, that there's different personalities and interests when it comes to finances. So if it's something you are interested in and like to do, then like that's awesome.
Yeah, and Steven's a lot smarter than me, so that's why he could do it himself. But if you're at my level, you might want to look into it. But no, I mean, it's
I'm
also,
learning from Hamza here.
No, dude, it's nice. So that's another thing is like when you do get out, the one thing I'd recommend is really establish a good network of dentists around you. Like that was something I think we talked about last time, was not to be competitive and not to like look at yourself as comparing to each other. Instead, try to like promote each other or lift each other up, because it'll always come back like tenfold. And that's kind of like how Steven and I's like relationship developed. We just, we're very like complementary towards each other, and he has a lot of attributes that like I look up to. And I mean, there's probably like one or two things he looks up to me for, but it's a good trade-off because I've learned a lot from him. Anytime I know something or learn something, I try to share it with him. And I think it's great because he's learned a lot through reading books and like doing all this financial, education himself. And I've learned a lot through the financial advisors that I can impart on him too. But yeah, I think the main thing is just drive. Like, you have to really want to do this stuff. And if you at least want to do it, you can go any route. Like, you can go Steven's route or my route, but the most important thing is to just take that first step of doing it, which a lot of people hold off or push off out of fear or lack of motivation. And I think that's the only factor that separates us from other people, I guess.
Yeah, I agree. Yeah.
Yeah. I mean, as someone that's still in the student stage, I think it's important that people at least kind of figure out their personality style when it comes to finances and have an idea of what they're going to want to do once they have a full income like that. Some dental students have already worked and then are coming back into school, but a lot of us haven't had like a full-time job ever even. So I know for me, I'm interested in finances and investing, and I would like love to read more books and everything. But similar to Hamza, I feel like I need someone professionally to be actually making the calls for me. So I feel like day one, I'm just going to like meet with someone and kind of come up with a game plan.
Don't get me wrong, there's books. Yeah. And if you're not a big reader, after dental school, I kind of got burnt out by reading books. So I listened to a lot of podcasts, and there's so many good resources for podcasts, like White Coat Investor is one of them. There's a lot of investor podcasts that aren't related. They're not pertaining to doctors, but at the end of the day, money's money, right? So like, once you start making it, there's smart ways to invest it. There's smart ways to use your money. There's smart ways to take what's called lazy money and invest it wisely and not just let it sit around. So there's common sense things that you can learn that way too. So, there's no excuse to not learn because there's so many mediums for it, whether it's YouTube. Like Lena, one of my friends, she's like a genius, and she watches like endless YouTube channels for, investing and how to like kind of move your money around in smart ways. So that's another thing to keep in mind is, if you're like Steven and you like reading, that's a great way to do it. If you're like me and you're not great at reading, there's podcasts and YouTube videos and a bunch of other avenues to go through.
Another thing I wanted to add is that after learning from different mediums and people, you realize that some authors or YouTube or podcast hosts have different personalities in terms of investing and managing money. For example, Ramsey. It's Ramsey, right?
Mm-hmm. Yeah, Dave Ramsey.
So he actually doesn't know like anything about dentists and our debt. And he thinks it's just crazy how we have 400, 500K. And I remember one caller calling in about that. And he was just saying, yeah, you just have to live in top ramen for the rest of your life. So he doesn't know anything about it, right? White Coat Investor, on the other hand, it's all about doctors, mostly physicians. Now, the difference between a physician and dentist is that they have a longer training period, but they usually get paid more. So that's a little different than us, where we have a short training period, but we can start off with a big variety of salaries. So that is something you have to keep in mind. If there's a mentor that's specific to dentists, that would be the best resource. I know there's a lot of CE that focuses on that. So that's what you want to focus on, that for looking for financial advice that relates specific to you, your personality, your risk tolerance, and investment strategy.
Yeah, that's great advice. And just keeping, I guess, on the topic of advice for the students that are preparing to graduate and enter into the real world. Last episode with both of you, we talked about contracts a bit already and like daily minimums to look for, just any kind of red flags. And just now we talked about debt and finances a little bit. Is there anything else that you would tell D4s that are looking into their first jobs?
I think there should always be a daily minimum. If there isn't, that's just a red flag that they can't even support you. There's so much work that they need to hire an associate. Otherwise, why can't you do the daily minimum? Hamza?
Mhm.
I agree with that. Yeah, I think that's important because, um, I mean, don't look at everything they show you on papers because sometimes that can be a little bit skewed based to kind of favor their cause. But you do really just have to go in with a lot of questions that pertain to you and your personality. And another thing I did was I had, D4s ahead of me that graduated already, had worked in the field for a year. So I reached out to them and I asked them like, hey, what questions like do you think I should ask the offices, or like how's your experience been at this office if I know that they're working at the same corporate practice. So it's always good to use your resources of friends that that have worked at the similar offices or anything. And then another thing I'd recommend is just making sure you understand the kind of environment or the area you're working in, because it can always influence what kind of procedures you do and how busy that practice is going to be as well. So like, because I worked in that community clinic last year, I was doing a lot of I basically hit the ground running, doing extractions, root canals, all that kind of stuff. So you have to really know, is that something you want to do? Is that something you're prepared for? Or do you want to go more the cosmetic route? So, don't just go to the first job that you get offered. You have to really figure out, is that something you want to actually do long term?
Do you guys feel like there's value in starting at an associate position, doing procedures that you don't want to do long-term in your career, if that makes sense? A lot of people might have more of an interest in cosmetics, but that takes a while to learn and to build up patience base. Do you think it's of value to get really good at endo if you're never going to use it later? Or should you just try to find a job that wants to train you in cosmetics, if that makes sense?
That's a good question. I chose general dentistry because I liked most of the procedures in all of dentistry, but I do like cosmetic stuff more. What I realized is when doing a lot of procedures, you kind of get, I guess, an intuition for teeth, how teeth to come together, the occlusion, and how that functions inside of your mouth. Because when you do cosmetics, it's not just how it looks, but you want it to function well too. And when you do a variety of procedures, and you see teeth breaking, you're taking teeth out. When you're taking teeth out, you notice where it tends to crack, or when you're removing a crown, removing a big filling and where it tends to crack. That gives you more experience with teeth in general. And I think that's valuable. But going into one specific thing, that's specializing, right? So that's why we have dental school before we specialize. So we have general knowledge of all of dentistry. So that's my take on it.
Mm-hmm.
I agree. I personally think it's important to do a bit of everything, because then you can kind of establish what you do like, what you don't like, and who knows, you might actually like something more than you thought you would, because dental school doesn't give you the big picture of everything. I think we learn a lot of stuff and we get to do a lot of stuff on patients in clinic, but you don't actually get to do, a variety of certain things, and I think once you get into the actual field, you get a lot more experience with doing complicated root canals or complicated extractions or even wisdom teeth extractions, and I think it also helps you establish a foundation of knowledge of how to do something right and how it's not done right. And that way, in your treatment planning process, you can actually look at an existing root canal and know if it was done incorrectly or if it needs to get retreated and stuff. And if you don't have that experience of doing a root canal or going through it, you might not see certain things a certain way. And this is probably a bad example, but it's kind of like dating people. When you see red flags, you have to sometimes date people and go through bad relationships, because then you identify red flags and then you can look back on it. And in your next relationship, you'll see those red flags and what's not right. And so I think it's the same thing with dentistry. Is once you actually start doing certain procedures, you can see how to do things right and how things aren't supposed to be done. And then you can identify those to help your treatment planning process.
Those are both great answers. I like those a lot. And still, I guess, talking about repetition, improving your skills from when you graduate dental school, because I mean, most people are not their best yet right away. Do either of you like wish you did a GPR or AEGD, or do you have like friends that did them, and how were their experiences?
Um, I haven't caught up with anybody from my class that has done a GPR AGD. I've talked to a few dental Instagram friends about people who do GPR AGD, but I think the experience is really like scattered. Just it really depends which GPR AEGD you do, and I think like dental school, it really depends like the work you put into it, or basically how you sell yourself and pushing yourself to do procedures that you don't normally do. But I'm in the Discord group for Implant Ninja, and some of the older dentists were talking about that too. When they were in GPR AGD, they felt like they were wasting time, didn't get to do what they wanted to do, but you still had to make the most out of it. So from what I hear about GPR AGD, you just really need to find a good one. For me, sometimes I do, because I also like doing surgery, which I got exposed to in dental school, doing like alveoplasty and tori removal, but I don't do any of that anymore here. I feel like if I had a GPR AGD, I could do that super easily, but it also depends on your office if it has equipment to support the procedures you want to do. Do you have CBCT? Because that's like gold standard. Putting implants in, you want to be able to see everything, and you don't want to just eyeball it with a 2D image. Sedation, do you have that for comfortable extractions or surgery? Otherwise, it's going to be hard for the patient. So it depends, I think, really what you like to do, and does a GPR AEGD satisfy for you? If you really want to have all the medical knowledge you can, so you can treat anybody that walks in the door, then a GPR and AGD would be good for you. If you want more practice, a GPR AGD would also be good for you.
Yeah, I was super impatient. I just wanted to get out and get into the field and start working. So I think it just kind of depends on the type of person you are and what you're looking to get out of your experience. I do have some friends that got a lot out of it, and I have some friends that regretted doing it. So I think I know it's not like the answer most people want, but it's a hit or miss for some people. And I think you have to really like have your heart set on it to decide if that's what you want to do. Because if your heart is set on it, you'll somehow make the most of it no matter what. And if you feel like that's something that's going to benefit you in the long run, like you didn't get enough experience in dental school, then I think that's a good thing to do. But if you just go out in the field and you just start working, like there's nothing to feel bad about with doing that, because again, it's what you make out of it. So like as soon as I went out, I just started trying to make the most of every experience at every job. And that's the only way you can really look at it, is like, no matter where you end up, whether it's AGD or working at a corporate office, you really have to take advantage of everything you can to learn from that environment.
Yeah, like any associate job or residency, it could be good or bad either way. So it's just kind of making the most of the chance to have experience, I think. Here's one last thing I wanted to talk about. And this isn't honestly something I'm just curious about. The initial adjustment into working, right? Like your first position, your first job, how did you like mentally and physically adjust to managing like a full day of patients? Like, what was that like?
Oh man, it was so hard for me. If you guys followed me during that time when I first started, because you go from 4 patients in dental school with break, with lunch, with walking around, to, for me, it was 16 to 20 patients a day back to back, chair to chair, middle procedure, jumping around after anesthetizing. And basically my neck was looking down the entire time, and it made me regret dentistry a lot. After I got better loops, it helped a lot. In terms of adjusting mentally, it was more like there's a lot of stuff I didn't know and I thought I knew, but I always had to, go back to the room and just say like, basically tell the patient, let me check that for you, or basically still say it in a way that, I'm confident, right? I've never seen this before, yada, yada. Let me check this up for you, but this is what I think. I just want to be absolutely sure for you. If it's really out of my scope, then I'll consult, one of my specialist friends, or ask any of my other friends. But you just got to be confident with yourself mentally to be able to work with a new environment. That what I didn't realize when you start practicing dentistry is a lot of people do not like being at the dental office, and you don't really get to exposed to that much in dental school. Maybe it's just like a couple in your patient pool, but because people are paying more than dental school, it's usually when finance is a factor, there's more stress involved, and then you have to manage that too. So yeah, it was a hard transition for me, but you just get used to it.
Yeah, I don't know how much more I can add off that. I think it's pretty much correct. It's just something you just have to acclimate to, and you really have to learn how to prioritize, and you also have to learn what's appropriate to do and what's not appropriate, as in kind of know your limits too, because sometimes we might get out there thinking that we're cowboys that can do anything, and you'll realize quick enough that if you try to do things that are out of your scope, it's really going to set back your schedule. So that's another like hard lesson you'll probably learn yourself. It's not something that I can tell you right now. It'll just be good, but like you'll learn it firsthand that like maybe I shouldn't have done that root canal. Like that took 2 hours, and now I'm way behind schedule. Or maybe I shouldn't have done that extraction because that was, took way more time than I expected to. So that's one thing I'd advise is definitely try to learn your limits, and don't take that as like a personal thing against your ego. It's more so just be smarter about that, because like Steven said, like at the end of the day, these are patients, and you want them to like you and you want them to see you again. So you don't want to be spending 3 hours on a procedure with them, because they're going to be like, I do not want to ever come to the dentist again. And not only that, but you're going to have other patients that are waiting around for you and upset, and it's going to affect your whole practice. Your assistants are going to be upset because now they're behind schedule and they have to stay after hours to clean up. So I think that's like the most important thing is it is going to be hard to handle a lot of patients, but the most important thing is to know how to handle them procedure wise, and like how to kind of manage your time in a smart way.
I feel oh, go ahead, Steven.
I was just going to add, yeah, sometimes you don't know how hard something is until you do it, and then you're going to have to finish. And that's when you learn over time how to read your radiographs better. That little curve is way more curved in a clinical situation. And that's why your extraction took 30 minutes instead of 5. Now you're behind schedule, like Hamza said. Like right now, I actually barely do any extractions when I loved extractions and surgery in dental school, because just the patient management issue of possibly running behind. You just realize there's some things you should be very efficient at. If you're not efficient with your time, you're going to have to choose what you like to do that is efficient. It's not so much of an issue for me because I'm salary based and I can do whatever I can for the patient. It just depends. I'm thinking more about time. In other situations, you would be thinking about the productivity of it in different office.
you also have to remember you don't have anyone to bail you out. And I think when we get out there, we come out with this mentality that like, okay, like I'll be able to do this, like it'll be fine. But you have to remember that if you're not able to do it, you don't have like a faculty member or someone next to you that's going to come bail you out. You have to refer the patient to another office, and that may be frustrating for the patient. You know, they may never come back to see you, so that affects you in a long run kind of situation. So I think that's something that I didn't think about during the first couple of months, and then I started thinking about that more, and it made more sense.
Yeah, you really have this like protective blanket in dental school that, oh yeah, I can do whatever I want, because you know in the back of your mind that there's faculty there to bail you out, even if they don't like check up on you a lot. You just mentally have this handicap because not handicap. You have a mental buff because your faculty is right there. It's a lot different when you're out practicing because you are the sole person responsible for all your decisions.
Like ballpark, I know it's probably really hard to estimate because we're always learning in dentistry. And even if now you feel comfortable, 5 years from now, you might be like, man, I still didn't really know anything then. But like, about how long did it take for you to kind of feel like in a flow and not super freaked out going into work?
I think more than 6 months. I think it's a little different for me. I heard for other offices, 6 months is where you hit your stride. For me, I think it's more than 6 months because I saw a lot of difficult procedures and patients that would present to me. But yeah, because in a federally qualified health center, you see really bad caries, broken teeth, and difficult situations where patients want to save their teeth. And sometimes it's not the best situation and they can't go to a specialist. So you have to do it because you're like the only one that they can afford. And they say like, yeah, if a file breaks, it's okay because we tried it with you and I understand. So it's in a federally qualified health center, it does push you to do more difficult procedures.
I'd say, I guess my story is different from Steven's because I basically worked at a corporate for 6 months, and I don't feel like I fully got a grasp of that. And then it wasn't until I went to the corporate office or the community clinic that I actually started to, like I said, I hit the ground running. So I think within about 2 to 3 months, I really started to build more of a flow and understanding. I was working with a lot of kids. So I was seeing a lot of kids and doing SSCs and phlebotomies. And I think in that way, you have to learn that quickly. There's no way around it because those kids they're like a whole different story. So after going from working with a lot of kids to now working in this office, I feel like if anything, it's become easier in a certain way, just because now I'm working with like adults who, aren't screaming or trying to bite my fingers. But it's also a different field. So now I have to learn a different kind of aspect of dentistry, which is like communicating with patients, establishing these relationships that are a lot deeper because I'll see them, for the foreseeable future. Whereas with the community clinic, there were patients that I probably wasn't going to see again. So I was trying to do as much as I could while they were there. So I think, even in dentistry, you might think that you've kind of gotten used to things and you're now like on a good flow, but then as soon as you're thrown into a different setting, it's a whole different story. So I think just like people always say that, that it's cliche, but they always say dentistry is a practice, but it's really true. Like, especially in like the flow of things, like you can never fully be like a perfect dentist because as soon as you're taken out of that environment and put in a new one, like you have to start fresh all over again. So never feel like you're like the perfect dentist or anything. Like there's always room to learn and adapt to different environments.
Yeah, and the standard of care is always developing too with like new technology or new materials you should be learning to use too. So dentistry is definitely a career that you're not just going to like cap out and then glide for the other 40 years. You definitely have to always be learning.
You won't be bored. You won't be bored.
Yeah.
And you also have to like think about like patients are getting smarter too. Like, there's so much education around us. So like you might think that you're like, the smartest person or whatever, but like in my setting, I'm working with a lot of like young tech kids who are obviously care about their health, which is great. But at the same time, they are also very much into researching why they're getting stuff done, or like what kind of crowns they're getting placed, like zirconia versus porcelain. Like it's just kind of crazy. Like I have patients ask me questions like that now. So that's another thing to keep in mind is depending on where you work, the patients could be different backgrounds, and you have to really adapt to that kind of setting and adapt your personality to that setting to match them so that they trust you more and they understand, they develop a bond and relationship with you. So you really have to kind of like adapt your personality to those patients as well to make them comfortable with you.
It probably throws you off the first time you get asked that. Like, why are we doing why are we doing this and that? Well, we have it here.
Yeah. And it's great though, because like that's another reason I moved to Austin. I moved to this area because like I'm a big tech nerd. I love, cars and Tesla and like Apple and all that. And I think like because of that, I've been able to adapt to my patients well because I can nerd out. I talk about music, movies, all that kind of stuff. And you develop this deep relationship with your patients and they start to trust you and really like see you as more of a friend than a provider. And I think that's so important in our field because that's the difference between doctors and dentists. I feel like dentists are seen more as like a personal, someone you see on a regular basis, whereas like doctors, people usually associate with like this like intimidating person that you go to when you're sick. But you even see it in movies and cartoons and stuff. Like dentists are always like kind of like that person the family all talks about or sees and stuff. So I think you should definitely take advantage of that too as a dentist and try to really build a relationship with your patients.
Nice. That was inspiring, Hamza. That made me like dentistry again for like 5 seconds. I'm just kidding.
Got you re-motivated there. That's the point of the podcast. There you go. We did cover a lot today already, a lot of good things, but I just wanted to give you guys one final chance if there's anything else that you really wanted to share today with people listening. Otherwise, we can wrap up.
Not on the top of my head.
That's fine. Yeah. I just, in case you were like, I really want to make sure I tell people this.
Well, I just want to bring up something that like I've focused a lot of time and energy on the past year, and I've talked about it with Steven, but I think like mental health has been like a huge thing for me in the past year. I really neglected that for my whole dental school career, and then also getting into the field, didn't really think about it much, but with things I've gone through in the last year, certain unfortunate circumstances, it's really brought a lot of that to light for me, and it's really been an important thing for me. Just like finances that we aren't taught about in dental school, I think mental health is a big thing too, that we're put in this field with a lot of stress and a lot of expectations. And just as dentists, like we're very we're anal, like we expect everything to go well, and when it doesn't, it does affect us in certain ways. So for all these dental students, like if you're listening, whether you're pre-dental or a dental student, if you feel like you're dealing with a lot of anxiety, a lot of pressure, or just like not in a good place, I highly advise you like really focus on your mental health and really looking to seek a therapist or taking advantage of your dental school psychologist or therapist that's there. I think that's something that you pay for that with your dental school tuition, so go take advantage of it. Just try to focus on that aspect of your life, because just like our physical health, our mental health is just as important. Like we spend all this time learning about ergonomics and having good posture and stuff, but it's just as important to have a good state of mind, because trust me, your patients can see that too. So if you're not in a good state of mind, it's also going to be something that's going to contribute to how patients feel around you or how comfortable they feel too. And you don't want to burn yourself out early. Like dentistry is a long-term game. I mean, you can definitely retire early, but you want to be happy ultimately with what you're doing. And a lot of us go into this profession because we love what we do and we love taking care of people, but you got to take care of yourself too. So, you got to make sure your health overall is good before you take care of other people's. So I've been harping on that a lot. I think that's super important because that's something I never heard a lot from these podcasts or, dentists I look up to. And I think it's unfortunate that it's like a stigma to a certain extent. So like just, any chance I get to kind of like stand on the soapbox about that, I think is a good opportunity to bring it up. And I think like people like Steven and all these other dentists I've talked about have been really awesome in supporting me through these situations. And like I really appreciate these friendships because Uh, they've, that's all what dentistry is. Like, we're a community of people to support each other. So I think that's something people need to remember too, is like, if you need help or if you need to reach out to someone, like, please do, like, don't hesitate. We're all here to like help each other.
Yeah, thank you for that. I definitely seek out support if people need it. I know I've needed it during school and I've been fortunate to find it. It's definitely there. So totally agree.
Cool. Thanks for doing
Well,
this, Haley.
yeah,
That's
thank you
really
guys.
awesome of you.
Yeah, I appreciate your time tonight. Do quickly before we finish, do you want to share your Instagram usernames if people aren't already following you?
So mine is Dentistry with Steven, and I have a website too, dentistrywithsteven.com. And on that website, I help pre-dental students get accepted in dental school. And so far, it's been 90% of the students that work with me get into dental school. So yeah, I'll be happy to work with any of you guys if you want to reach out.
My Instagram is Mogaj, Mogaj, and I don't have a cool website like Steven, but if you want to reach out to me just to talk, or if you have any questions or anything, feel free to message me. Or yeah, that's about it.
Yeah, I can attest that they're both great guys, great dentists, and awesome resources. So definitely recommend that you all check them out.